Hi, I just wanted to make a video explaining why I'm interested in anaesthesia as a non-medical professional. It's to do with outpatient hysteroscopy, endoscopy basically. My wife's had to have a few tests a while ago, and it raised the concern that women are purposely talked out of anaesthesia if they're offered anaesthesia at all, not warned of the risks of severe pain, and are often given exaggerated risks of anaesthesia and are not given a balanced view. And the fact is that it's done to save money, but the reality is that many women are complaining that they will not return for further tests. So effectively, it's more dangerous to not do these procedures under anaesthesia than it is to be done under anaesthesia. Also, there's a lot of pressure, finding a lot of clinicians saying how risky GA is, and we don't want to GA and basically being offered a GA or a paracetamol. To my surprise, when I actually talk to anaesthetists and they talk about their passion for regional anaesthesia and the benefits it brings without compromising pain relief, I'm amazed at their compassion and their care for patients. And the fact is, the way it's been structured economically, did you know that if a hysteroscopy is performed in theatre, particularly a diagnostic, they're not paid enough. So the theatre actually loses money. Yet they're actually paid currently £40 more to do this in outpatient. So they'll on average make about £350. This has been achieved by companies by Hologic, Medtronic, Olympus, wining and dining clients. Hologic have been known to do several talks with wine and lobster, and pay for hotels and pay for training and pay for I forget what they call it in the UK, scholarships effectively. So this has been heavily promoted by cash basically, and the very big similarities and the vaginal mesh, i.e. manufacturers dictating what goes on rather than the other way around. And I would actually say, as I believe it's synthetic, I hope I'm pronouncing that right, I would actually say you have a moral duty to sell more anaesthetic, not just, I understand you're a business and I want you to make money, and I actually think you have a moral duty to sell more anaesthetic. This procedure is a recent study's been done and found that even with a cervical block, local anaesthetic, 18% were very painful and only 7% had no pain. And to top that off, this is a particularly good hospital. Trial done and Bart's at Wimps Hospital found that 40% had severe pain. The average is about 25%. So again, I'm not advocating that women should not be given a choice. I'm advocating for choice, but they should also be given honest information. Particularly in this pandemic, women have been forced with delays of diagnosis for cancer, and it's just not fair. I mean, when I spoke to McMillan's, he said this is a slow cancer. 6 months. 6 months is not ideal, but it's not the end of the world. And they're emotional blackmailing women, threatening women of delay of 2 weeks, an extra few days, basically, when it's often not critical. So I just wanted to thank you and thank thank your company for what you do and how respectful you are. At one of your videos, you said there was no patience in this video. Well, unfortunately, there's been promotional material of scope manufacturers of women in stirrups, often don't have the faces, but women in stirrups without the blinds closed. There's a total lack of dignity and respect for what goes on, which I have never come across with an anaesthetist ever. They seem to be far more caring and compassionate, and it's money driven. So I just wanted to say thank you, and if there's any more information you would like or anything, I really do think that you need to be pushing for women to have this. I know that some anaesthetists have it has been brought up to their attention, but as a company, I really do think that you need to. It would be good if you could put your foot in the door, say no, these women should have pain relief for endoscopy like they do for colonoscopies and whatnot. So thanks, bye.